preparing to go live.
We're live.
We're live. All right. So today we're going to be discussing what a doctor asks you. He says he's going to do a stool test on you. Okay. A stool test. But what does that mean? Freak us out. Well, what is a stool test? A stool test has a lot of purposes, but mainly it's to see what is inside our poop, and it's a poop test. So what we want to do is we want to understand what is a poop test. We want to demystify a poop test and to clarify the reasons for why we would do a poop test, right? So you see a lot of commercials nowadays doing a GI map. You want to poop and shoot it and send it out and mail it away, but it's sometimes confusing as to the procedure and the protocol. Now, what we've been discussing over a period of time is a functional look at actually nutrition as well as the treatment protocols that we use. So what we're going to be doing, Ana Paola, we're going to go over the nutritional reasons that we do things. We're going to look at also what Adriana and Faith are going to be discussing from a personal note as to what goes on. So each one of these individuals has actually run a sample test on themselves and see what actually is going on. So once we see what is happening, Ana, do me a favor, if you can prepare, because I will have you go through the host on this whole show, a presentation of actually the results sample report for the GI map. Also, you can also do it for the GI, FX. So we want to make sure that we use different types of tests to do stool analysis. Now, why would a doctor do a stool analysis? There's many reasons, where there's enzymes, gut disorders, things like leaky gut, SIBO, which is small intestinal bacterial overgrowth. The basis of many pathologies is inflammation, and what we're learning over the last couple of decades is the tight integration that colon health has a lot to do with inflammation. So whether it's a joint problem, such as things that I get in my office, like a back problem or chronic knee pains, or not that are injury based, because sometimes, and the majority of times, there are knee injuries that are related to a twist of an injury, but sometimes people come in with many joint problems and they're inflamed all over their organism. So what we have to do is we have to figure out what's causing inflammation. Now, if we can discern that it is something that doesn't have some sort of cause or etiology related to some trauma or arthritic issue or maybe some degenerative issue, we look further and we look at the physiology of it. So we do a detailed assessment, a detailed functional wellness history to determine what's actually going on. Many times, doctors figure out that we have to look at the intestinal dynamics. And when we do that, what we want to do is we want to be able to order certain tests. So we have a few tests that we have at our disposal. One is the GI maps, one is the GI effects, which really are the top of the line tests to see exactly what's happening with your bacteria and seeing what's actually going on. So there are things that we look at. Now, in your experience, I'm going to go to Adriana first here. Tell us a little bit about the things that we look for in the bacterial dynamics when we look at a person's poop, so to speak, right? But then we'll go over actually how we do the procedure, because it's very simple to show you how it is, but we want to tell you the why. Why do we do this? So tell us what you have learned in the process of what we're assessing here.
Sure. Well, the test is done just to assess the interaction that we have with our microbiome and the host. So we want to see what kind of bacteria we have in our gut. And that will give us indications about digestive problems, immune system problems, measuring how our microbiotic DNA health is. We can see viruses, fungi, parasites, all this, and also the level of inflammation that we can have just doing this test.
It is incredible what we can learn. Zonulin has been figured out that it's a compound that we produce, and when we start seeing it, we start noticing that we have a breakdown of the intestinal wall. This leads to, I guess, our bacteria, and its byproducts and trash and the junk and the poop and the bad stuff entering our bloodstream. So when zonulin goes up, we can discuss that later, but we want to evaluate that as well. So in from this particular point of view, I'd like you, Ana, to also give us what you have learned and the reasons why we do these tests, and then I'll add to that.
I have found that the most important part of why we do this test is because patients actually connect the fact that their gut health directly affects their pain symptoms, their ability to respond to different interactions with food. So I found that more than just figuring out what kind of bacteria do we have, or if we have gut permeability, or if we are or if our inflammation is coming from our gut, is basically how your gut health fully responds or correlates to your total health. So I feel that we can use them in many, many aspects of health assessment.
Absolutely.
So,
We have been able to really see and that the population is getting it, and more as time goes on, because the word is out that a healthy gut is a healthy human, and not only just at the area of just bacterial dynamics, but things like anxiety, stresses, the way inflammation responds, the way your body can heal, the way your immune system responds. People may not know this, but the large majority of your immune system is in your intestinal wall. So what happens is, as you eat things, you've got to protect it against the outside world. So it's natural to see how when God created us, that the intestinal biome is our first line of defense in many aspects of what's going on. So Faith, tell me what you've also kind of learned in the process of doing these GI maps and also these stool analysis that we do.
Right. So the stool analysis is so important because it takes a look at the total health of the gut, and the gut is frequently referred to as the second brain of the body because it determines so many, your moods, your attitude, your sleep, how you act from day to day. And so if people are experiencing inflammation, when they do this stool test, we can see what good bacteria and bad bacteria they have within their body. And then we can go ahead and adjust the diet, give them supplements, and really start to make their gut better through those supplements and diets over a period of time, months, weeks, etc.
You know, as we did this, we wanted to demystify what is a stool test or a poop test. There's lots of ways of doing it, but we pretty much got the general dynamics in what we're going to present today. So one of the things is you'll get a box like this that is full of some goodies, okay, and it's called the GI microbial assay. Assay is just a word to say evaluation testing. Plus, that really is the standard of how we measure things. Now, this is only one of the types of tests that we have. We have quite a few tests in our arsenal, but this makes it really easy to understand it. You'll find a box with some products in it, and you'll see that as we do these things, you'll be able to see that there's as we pop out these things, there's a little tube here. There's a little tray, you know, for those that kind of know about Chico's Tacos, you know, this is a place where you kind of do your thing, right? And it comes in a bag, okay? And this thing comes in a bag. This is going to be delivered in that process. And you also get a delivery package, okay? So you can FedEx this, okay? So as we go through the process, one of the things that we did was we had to go through the procedure of how we do this. So I'm going to pass my little tool over here because I know the young ladies did this. And tell us a little bit about the process as you look at your box. Adriana, go ahead and present what you which one you saw and how we actually presented. So you receive this box, okay, and now you have to do something with it, right? So let's take a look at it. So she's got this box, you get this, and you've been told to do this test by your doctor. And what are you going to do?
So the first thing that you do is that you
don't freak. Okay. That's the first thing. Don't freak out.
That's the most important thing. And then it has a set of instructions. They're very self-explanatory and they really help guide you through the process. Okay. With pictures and everything. So the first thing you do is you have to put in this bag. There is a little container. There you go.
There you go.
Here it is. Okay. So the first thing, you put your gloves on. Okay.
Yes. Got to put your gloves on. And why would you put your gloves on for our nurse in the room?
So that you don't infect anything else. You have to be free of bacteria. Keep your area clean.
Because cleanliness is next to
godliness.
There you go. We're getting it. Go ahead. Keep on going. Sorry.
Okay. So then you get the bottom. Well, you get first your tray. And then you're going
Now, does that look like Chico's Tacos thing?
It does.
It does. It does. Like,
It does.
all right. All right. All right. Go ahead.
Okay. And then you're literally going to poop in here. So, I mean, it's very graphic, but you kind of squat and just put it underneath and you poop enough that you can take your sample out. So in this little bottle, when you open it, it has a little scoop
in it.
Okay. And you're going to take out 4 scoops of your sample and you're going to put it in here. Okay. When you put it in here, please throw this away. Don't leave it close to the children. No,
Yeah,
just
you don't
kidding.
want it to be surprised for your family. Look what I did. It's a gift.
Take it away from your children.
Mom. Trauma forever. Right.
And then with this, you're just going to shake it really hard. Okay. You need to type. Please make sure it's really tight.
Yeah, before you
just
shake it.
before you do anything. And then you're going to shake it out. Okay. After you shake it out, you put it in your little bag. Okay. There's a form that you have to fill out. This one. With all your information. Okay. And after you fill this out, you put this little sample bottle in your bag, you zip your bag, and this is so easy that even brings your FedEx envelope, which makes it easier and discreet for you to walk into FedEx and not know what you're sending
Yes,
out.
we did forget one thing. We need to put the absorbent
Oh,
thing in there.
yes.
Yes, you got to put the little absorbent thing because sometimes we want to make sure
Yes.
that the people opening it up, that doesn't get some surprise either.
This, you put it in the bag. Okay. And the idea is that any liquid comes out, it's absorbed by it. And then you put it in your FedEx envelope and you ship it. You take it to FedEx and you ship it. So it's really easy, very comfortable. The only part that might be uncomfortable is like pooping in the little tray. But other than that, it's very discreet. Nobody will know what you did. And you can send it out.
Yeah, it's that simple. It's that simple.
Super
So
easy.
it's really simple. I know we make kind of a light of it because it is kind of a light thing. Make sure you wear the gloves, make sure that everything is closed up, make sure you call FedEx. They'll come and pick it up for you. So these are simple. This particular one was a GI map. And then you put in, obviously, you put in the box and put it into the FedEx package. So it goes back and it's nice and solid. So that's a good question. Wait, do we send it back? We don't send the box back, do we? Or do we? Yes, we do. We put it in the box and then send it in the box. Yes.
Yes.
Because the box protects the box. Okay. So it's big
Yes.
enough to hold
It's
it.
big
So
enough. The envelope
yes.
is big enough to hold.
yes.
the
So
back,
it makes
the
sure
box.
that goes on. So in that process, we're going to learn a lot. Okay. First of all, even you may believe that a small sample does not have a complete bacterial balance. However, just remember that from the time you've eaten, okay, this has been churned and churned and churned and churned inside the colon. And realistically, it is a good, it does give us a balance of that. Now, one of the things that they do tell us to do is to avoid drinking or taking any aspirin for about 2 to 3 days prior to this, because we don't want to cause any sort of blood that's going to be in stool, because we're going to be measuring sort of blood and we're going to be measuring different types of bacteria. Now, as she mentioned, from fungus to viruses to bacteria to different things like chlamydia, we're going to be able to find out what type of balance that you have. Now, as a result, we're going to be able to tell you what type of supplements, what type of enzymes, what type of breakdown products that you can take as a result of your deficiency, or maybe you have a very good balance. So I would like to give host position to Ana in a second. She's going to review a little bit of a report to let you see what we do see. Are you ready, Ana?
Yes. Which one do you want me to
Let's
do
just
that?
take a look at do both of them actually, if you want to. Just kind of like a general thing. I'm going to give you. It says make. Oh, you already have co-host capacity, right? So can you share your screen?
Let me do that for you. Continue. And we will start with the GI effects because I wanted to make an important, can you see it?
Yes,
Oh,
I sure
it's right
can.
here.
We sure can.
Okay. Something that we have to do specifically with the GI effects is that we want to make sure that the person let 4 weeks pass if she or he had a colonoscopy before doing the stool testing.
Anna, sorry,
It's
to
very
interrupt,
important.
but it's not sharing.
Oh, it's not. I see it. I see the sharing.
Oh,
I do see the
this
sharing.
is, yeah. So I am
got it.
sharing currently
Yeah, I do see the sharing.
the results overview. I just wanted to do that quick point because there are like certain specific requirements for us to do before we start with the stool recollection. So that is like the main thing. Also, we need to quit all the different antibiotics or probiotics if we're taking some of them. So just make sure that 2 weeks prior collecting your stool collection, you do not take either antibiotics or probiotics. That is like key for getting reliable results from your stool tests. So when you finally get your results through your stool collection, we will be able to see if you either have maldigestion, if you have any kind of dysbiosis. We're going to be able to find out if you have inflammation and what can we do to heal that inflammation. And also we can see if we have any kind of microbial infection or virus infection. So this is very useful, specifically if we're talking about the GI effects profile test, because it's like very comprehensive. It's like a full test, and I like it because of that. So we were talking also about the different biomarkers that we are able to get from this testing, and the digestive support test is very important for us. So maybe if our patient had maybe she's lacking her gallbladder and we do not know, we might be able to see if she or he has like certain pancreatic elastase or any kind of enzymatic deficiency. So this is like great for us. So another thing, maybe what I can do is to share, to see the main differences between the GI effects from Genova. And I will share also, did I stop my sharing?
It appears that way.
Mm-hmm.
Yeah.
Okay. And maybe I can share my GI map sample. So
Absolutely.
let me know when it is ready.
It is live.
Okay. So there's like certain differences between the GI effects and the GI map. Firstly, we can see that GI map is, it's a DNA stool analysis. So it's going to tell you exactly what kind of differences or what kind of quantity or the DNA present of pathogens or different viruses. And specifically, this is very important, H. pylori.
Anna, can you go back up to where you started in the beginning? One of the things
here.
Yes, right there. If you see, these are pathogens. So sometimes we're given points of views that you'll see some for E. coli 0157, you'll see a number there. These are pathogens, so they're not good. So they're not commensal, which are good bacteria. So the excessive amount is that number. So even though that 8.60 it reflects a non-red thing, it's not that. It needs to be considered. Yersinia enterocolitica. Also, it needs to be considered along with the difficile A and toxin B also. So we have to look at these and to put that into our overall clinical understanding of what's going on with the patient. So it's not so much that it's not in red, but we've also have to look at also the ones that are actually being calculated as well.
Like this one. So that is like a very interesting and important point. So this is, this is very interesting. And the main thing or the main difference between the GI effects and the GI map is that the GI map will only throw you the results instead of giving you what are like the next step of action, which is like the treatment plan. but it will tell you exactly what is going on and what is present in your GI tract. So I find that this information is very, very useful if we are suspicious about Clostridium difficile, toxin A or toxin B, or either type of pathogens right here present. Another thing that we have to consider right here is that we have the commensal bacteria or the normal bacterial flora, and it will tell us what is the amount and which type of different phylum or different families are running low in our gastrointestinal tract, and which type of phyla of microbiota it's low. But it also manages to give us the firmicutes to bacteroides ratio, which is really, really important just to see if we have a balanced gut microbiota. So this is very interesting as well. And the other critical information that is also provided with the Genova GI effects tool profile is that we get the opportunistic bacteria or those family of bacteria that actually contribute to SIBO or to IBS. So this is also something that could be used for us to follow up with the treatment of this patient. So, and also another very important thing is the yeast and bacterial composition that we are carrying in our body. So right now we can see that in this sample, the patient is pretty much normal and it's bacteria and fungi and yeast free. And that is very, very great. And also the viruses, something else. Oh, this is very intense. So something that you mentioned previously was the Sonulin Test, which actually is an important marker for gut permeability. So right here, we can see that the patient has gut permeability. This is, once again, one of the main differences between the GI map and the Genova GI effects. Like, it doesn't really tell us what is going on, even though it provides us with the with the amounts and the results. So this is maybe a test that I would rather read as a clinician than to give to my patient, because I find it easier to read the GI effects as a tool than the GI map. Well, personally, that's what I think.
We use them both differently, and depending on the situation, we like to sometimes patients want to they just want someone to take care of it. Some people want to become really part of their nutritional and their recovery process. For those patients, we like the effects. For those that are real into the science of this GI maps, and GI maps has been considered the main tester, the more go-to one that most clinicians go to, most clinical environments, hospitals. So what we need to do is we need to figure out what's best for the patient and see what's actually happening. So the correlation, the association, the coincidence, and the causation of disorders gets put together in the clinical story. So we just can't just say that the bacteria is the cause. That goes along with a lot of things going on, from environmental to dynamics to physical to emotional, to even, the history of trauma that they've been experiencing. So there's a lot of reasons why inflammation gets its basis. So when you see Zonulin, it could be a fact it's a food sensitivity, or even an immune reaction that is causing to foods that are not favorable to the individual. Gluten itself will cause a enormous amount of release of Zonulin, because it's kind of like blades. There are different foods that irritate the intestinal walls, and we need to change people's diet, because once you establish a normal flora and get the bacteria as your buddies, okay, as your friends, and you work with it, then you can really take on a lot of indirect and direct health benefits. So what we want to do is we want to learn about these processes. Today was to demystify the procedure, to understand the dynamics of taking a stool test to from the moment you take your assay and you send it off, that it's demystified. It's not complex. It's not hard. So I got a question for our young nurse to be here, that she's going to tell us a little bit. How did you feel when you were talking about when you were looking at the GI maps? How did you feel? Particularly, what I want to do is I want to open up the fact of how did you feel having to work with this?
Right. So what I consider it is it may seem uncomfortable at first, but it's a tool to help you improve your health. So I started to view it as that way, and just seeing that when I do this, I'm going to get better. And I hope that the patient sees that as a similar way, and that once we see these results, we can help to pinpoint the areas where they're experiencing inflammation. And so it may feel uncomfortable, but we're all healthcare professionals who really want to help the patient ultimately get better. And this is a tool that will really help us to do that for them.
Excellent. And Adriana, how did you feel when you were having to kind of like work through opening this box and kind of figure out what a patient would go through?
Well, I want to relate to the patient as, of course, you open the box and you see the little tray and you're like, oh my goodness, what do I have to do now? That would be the first impression. Okay. And then of course it can be uncomfortable if you haven't done it before. I think as a mom, when you've cleaned so many diapers, you kind of get used to getting your hands messy. So you're like, okay, I can do this. But definitely it can make people feel a little awkward, because trying to figure out how to use the tray, how to put it in position where you can use it, so that can be a little, I can relate to being a little uncomfortable, but definitely, as Faith says, at the end of the day, just have in mind that this is because you have an issue and you want to get to the bottom of that issue. And this is one of the tools that will help us diagnose what you have.
Now, talk to me about how you recommend people perceive this and go forward with this type of testing.
First of all, I think that patients have to compromise with the treatment. And once they made a connection between gut health and everything that it affects, they are fully committed to doing whatever it takes to go back to their normal health or to improve their health. So I guess that is like the first thing that I think about when I get these packages. And the second thing that I think about is to refrigerate your samples. That is the second thing that comes into my mind. Truly.
Well, truly, it's usually good. So you can probably do it on Sunday and refrigerate it so that on Monday morning it goes out. They do indicate that by Friday we should have the results. So that would be a good thing. So maybe Sunday, do it on Sunday evening, if possible, or some time during the day when nature calls. But the idea is to get it out by Monday, and it basically by Friday we got the results. We do different types of tests, some from Vibrant, some from Great Plains, some from GI Maps, some from US Biotechs and doctors' data. We do different types of procedures. Functional wellness really is it's a spinoff of functional medicine, and we pretty much correlate it with inflammation. And our goal is to see what are the things that are causing inflammation in the body. So it's not so apparent. So again, we got to get to the root cause. Not only it could be related to an injury, but I'm finding more and more as time goes on that our patients are highly educated, and sometimes that they may have a trauma, an injury after a bout of sometimes some as extreme as 2-3 years of antibiotic use, and all of a sudden they have a lot of drama as a result of that, and they don't realize what's happened. And our buddies, our bacteria, have been affected as a result of that, causing indirect results in our body, specifically in our inflammation dynamics. I just wanted to thank you guys. Don't want to take more than half an hour. We are at around exactly about a good 30 minutes. We discussed some issues here. We talked it. We'll go ahead and elaborate on the next one. We'll be covering up some more complex issues. So as we go through these processes, thank you, Adriana. Thank you, Faith. And thank you, Ana, for presenting your point of view from a female point of view, because sometimes, it's important to understand the dynamics. I don't know. It's for me as a guy, it'd be pretty easy, but it's good to have a point of view. Okay. So I hope that made sense. You guys have a good one. And thank you very much, and look forward to discussing the next topic in the functional medicine, functional wellness, functional nutritional dynamics of getting better in your body. Thank you. Bye, guys.
Bye.